Our topic for today is stretching. Massage nowadays incorporated also with some stretching. Stretching is the kind of movement slow, gentle, and sustained. Stretching is also a kind of movement of muscle, which is the insertion and the origin of the muscle is move away each other. We can do the stretching from head to toe. Some stretching includes active isolated stretch, which is AIS. AIS or active isolated stretch is also known as unassisted static stretch, which is active is established by your client. Like example, can you do flexion stretch? Can you do some traction stretch? Okay. That stretch can called active. Your client is the one who does it. But if you want it to be a passive stretch, if you do the retraction stretch, you add it on. Then, that is now called passive stretch. The massage therapy is the one who does the stretch. Make it active stretch, then we'll make it passive stretch. The therapist assisted the client. Assisted static stretch. Stretch is also kind of the movement that helps the muscle to correct the range of motion. It helps the muscle to circulate better if we put the stretch on the muscle. This kind of stretch is passive stretch. Passive stretch, the massage therapy is the one who do the stretch. But if we ask our client to raise these legs for him to stretch it, that's an active stretch, also known as AIS, active isolated stretch. There is also a stretch that we call PNF. PNF means proprioceptive neuromuscular facilitation. This stretch also help to strengthen the muscle. Ask our client to raise up to the stretch that he can. That is active. Then we add on, that is passive. Then now we will ask them to fight back, then relax. Then after they relax, we add some stretch, then that become PNF, proprioceptive neuromuscular facilitation. First, we're gonna do active. So the client is the one who do the stretch. Can you stretch your hamstring? Then when we are the one who add on, it will become passive. And this is become assisted stretch. Then to become PNF or proprioceptive neuromuscular facilitation, we will gonna do some push, then fight back, then relax. When your client relax the muscle, then push again, then fight back, then relax. When they relax, push again, This kind of stretch, VNF, is helping to strengthen the muscle. Then relax, then push again, then relax, then push again, then relax, until they cannot able to fight back. Then you strengthen the muscle. If there's a pain, we don't need to stretch the muscle. But if there's no pain, we have free to stretch the muscle. Gonna do it to the other side of the leg also to make sure it balance. Stretch on the neck. Like 3 seconds. Then put it back with support. One more. Make sure that we stretch with support and let them inhale and exhale. That is a flexion stretch. And this one, we're gonna do sideways, lateral stretch, lateral stretch on the other side. 1, 2, 3 seconds. And back to neutral. On to, we're gonna do abduction stretch, and adduction stretch. And we also flexion stretch and retraction stretch. And we can push also the foot by stretching, retraction, and flexion. In stretch, make sure our client is securely locked so that they are comfortable and feeling safe. Flexion stretch. Flexion stretch. We need to secure the foot of their client. Flexion stretch. We need to make sure we support the knee of our client, and on the foot we support, then push. Then wait 1, 2, 3 seconds, then release and back to neutral at least 3 times. And make sure, and for stretching, we put far each time we stretch. Then let's do it again. Then try to make it farther as we can. Then back to neutral. Do it again. Push. Then 1, 2, 3. Then back to neutral. So that is a stretch on the knee. Every stretch that we perform to our client, it is important that we know the movement of the body. So the next video that we're gonna do is the movement of the body. Please subscribe to my channel.